All right, we are live. Good evening, folks. Welcome to this uh, panel discussion with the with a very powerful team of an all-women team or an all-woman team, and it is my pleasure as the only man here to have all these very fine um, folks in their field discussing COVID-19, the response effort, and the vaccination and the benefits and all the conspiracy theories surrounding them. Of course, they're not important. The vaccines have proven to work, and this very fine team of panelists from ACER's Health Equity uh, team is here to discuss it with me today. We have with us uh, Sohini Bag. We have Aru Sasikuma. I hope I pronounced that name correctly. And we have Posa Aswani. Good evening, ladies, and welcome. It's my humble pleasure to be your host this evening to discuss something that everyone who's watching, YouTube and via YouTube and Facebook, we already have almost 300 people watching right now. There's a lot to learn from these fine women that we have here. Good, good. So each of you, we have the opportunity to just tell our audience a little bit about yourself, professionally, of course, and before we hit the ball rolling and get into the nitty gritty of why we're here this evening. Again, it's my pleasure, humble pleasure, to have three fine panelists to discuss COVID-19, the response effort, and the vaccination, the benefits of getting vaccinated, and why we all must get the vaccine. So we're going to begin with Sohini. Sohini, kindly unmute yourself and tell us a little bit about yourself.
Hi, my name is Sohini Bag. I'm the program coordinator of health equity over here at ACER. And I have a master's in healthcare administration from St. Louis University. It's a pleasure being here and being able to talk about some of the amazing work and with the community that we have been able to do over the past 2 years.
Sohini, thank you very, very much. And it is our pleasure to have you this evening with us. We're going to go to Aru. Good evening, Aru.
Hi, Mr. Henry Costa. Thank you so much for having me over here. This is a great pleasure. I'm Aru Shashikumar. I work as a program manager for the health equity team at ACER. ACER stands for African Career Education and Resources. I have a master in public health with a focus on public health administration and policy. And all my past work experience has been regarding community health with a focus on the larger Black community.
Very powerful panel. We will go to Posa Aswani.
Hello, my name is Posa Aswani. I'm actually a general practitioner, trained in medicine at the University of Nairobi and practiced there. And I also have a master's in tropical and infectious disease from the same university. But currently, I'm studying a master's in public health as I'm shifting from the clinical side to the community health, to the public health side. And my role at ACER is a health equity intern, and it's been a pleasure learning from the two ladies here and our founder and the rest of the ACER team. And I'm happy to be here. Thank you for having us.
The pleasure is all mine. In the healthcare profession, talking about the subject matter that they know very, very well, very much about, and currently work in. So, having taken care of the introduction, we're going to go to enterprise. How is ACER involved? How did ACER get involved in the pandemic response work? This question goes to Aru. You want to be first to take a stab at that? How did ACER get involved in the pandemic response work?
Oh yeah, sure. I can definitely go on that first, and it is definitely long answer rather. So ACER, I want to start with talking a little bit about what ACER in general does in the community. So, being an issue-based nonprofit organization established in Brooklyn Park, ACER essentially has built a long-term trust in the community. Communities always come up to us, raising the voices, and we have been that essential bridge between authorities, the decision makers, and the community. We constantly bring up their concerns. And it is quite a popularly known fact that health disparities are predominantly seen among communities of color, and health outcomes. There's a disproportionate impact in terms of health outcomes in communities of color. And in 2020, when the pandemic came about, those disparities were merely highlighted. And ACER, being that strong community organization, had to step up and figure out how we were coming in use for the community. In 2020, when the pandemic was out there, there was a lot of confusion, a lot of chaos. Facts and myths were quite intertwined in the media, and it was quite hard for the community to figure out what sources to trust. And I guess that's where ACER had the biggest stake, being that trusted source to share the right information on the pandemic. The COVID-19 led to massive rates of unemployment. People were unable to pay rents, let alone, buy baby products. Food insecurity was rampant, and mental health resources was a necessity more than ever. And the resources were essentially out there, but having somebody to connect community to those resources out there, especially communities of color, was essential. So I guess that's where Minnesota Department of Health came about and put out COVID-19 Community Coordinator Grant. Going forward, I guess our team is constantly going to refer to as CCC, which stands for COVID-19 Community Coordinator. Essentially giving a chance to community organizations out there, just like ACER, to play that role of a navigator, helping communities connect to the right messaging, right information, and the resources that they could use. ACER, since I guess late 2020, has been that CCC coordinator in the community. And one of the biggest resources that we put out there that still continues to was a COVID-19 dedicated hotline, where we had recruited a bunch of community navigators who spoke Pidgin English and Spanish, essentially connecting them to rental assistance applications, helping them fill out those forms, giving them the right information on the pandemic, be it about social distancing, where to access PPE materials, masks, testing kits, and where, yes, yeah. And in 2021, when vaccines were available, how does one figure out the nearby vaccine clinic? How do they register for a vaccine clinic? So the navigators were out there helping them out through these essential hotline services. And the same CCC grant helped ACER, put ourselves out there, sharing those PPEs, masks, testing kits. And in 2021, when vaccines were available, we were also hosting some of those vaccination clinics. And I guess that was one of the major areas in which we were able to help. We also had other projects going on during COVID-19, which helped us serve the community, WEEP being a very important one. And I can let my coworker Sohini talk more about it.
So, like we saw, yeah, like we saw how in Minnesota, obviously this pandemic has been a global issue. So WEEP is a project that is more nationwide, and the focus was very much on education, because one of the things that came up was the fast pace in which wrong information, false information spreads so much faster than the truth spreads. So the focus of WEEP was to get that access to our community. And because it is a nationwide project, we were able to connect with other community organizations facing similar issues and brainstorm ways to like build our community up and just continue in making sure that our community is safe and has access to accurate factual information.
That's very good. That's very good. That's true. So, Hini, on the onset, there was a lot of conspiracy theories out there, and people were confused, and people didn't trust. They didn't know which information to trust, and ACER has been very instrumental in helping to bridge that and fix that and address that particular issue. Posta, let's come to you. You've been engaged with ACER and the work they're doing in the public health sector. And what has been your experience so far in what you've been engaged in, specifically COVID related, since COVID broke out in 2020 in the US? How has it been as someone in the medical field?
Um, First of all, I'd like my medical colleagues to actually take time and join such organizations, community groups like ASAP, because we need to learn from them. Because my eyes have been open wider than they were before. I think in medical textbooks we just talk about social determinants of health, and we don't even actually know what that means. So ACER has been a bridge for those social determinants of health. When you think about our African community, the last time my mother, if she's here, got her vaccine was when she was taking a flight here at the IOM offices in Nairobi. And once she gets here, she's done. One of the biggest challenges we have is the administrative burden, like just making an appointment to get a vaccine is hard because they need to navigate the computer, need to navigate the internet and get all that. Our people are working throughout the day, so they don't have time to actually go for these vaccinations. So I feel like vaccine. What ACER has done, which is a beautiful job, is meet the people where they are. So we've provided education materials in the main languages that are spoken amongst the African community, and that's in in the immigrant community, and that's Hispanic, Pidgin English. I've actually translated some in Swahili. So we've bridged that education gap. And in terms of testing, we are amongst the largest community groups that are actually giving out the testing kits, because it was a huge problem just getting tested. The lines, like if in Brooklyn Park, I was telling Sohini and Aru, was like going to a political rally or a voting day back in Africa. So that gap has been bridged by ACER and other groups, and it has opened my eyes as a clinician, so that when you think about why someone doesn't access or do what you tell them, think about what they're experiencing at their own level. So it's a beautiful job. We need to support community organizations like ACER more and more.
That's very, very true. The difficulty in getting tested. I mean, you have to make an appointment. It takes days, and so yeah, just being able to do these things, have these resources, and make them accessible to the people who need them in the shortest possible time. That must be rewarding work in this particular difficult period. Which thankfully is becoming much more livable than it was when it was hit in 2020. Thank you very much. There, we're gonna go to our next question here. What purpose do you think the COVID-19 community coordinators uh, serve? What purpose exactly? Sohini, let's begin with you. Uh, Even at this stage of the pandemic, do you think the work that the COVID-19 community coordinators do you think that work is still very important today?
Absolutely. As we know, I'm going to talk specifically about our education access that we've been focusing on, which is that, like with most new things, there is new information, new research that is continuously coming forward. And when there is new research coming forward, there is also new types of false information coming forward. These community navigators are embedded in the community. We talk to the people, we listen to what they have to say, and we understand what they are experiencing, which allows us to see how to respond to this new information from their light and really get that message across that, yes, this is a relatively new vaccine and we're going to keep learning about it, but that doesn't mean it doesn't work right now, doesn't mean it's going to stop working later. Having those conversations at a peer-to-peer level is only possible by community organizations.
That's very, very important. I like the way she put it. Aru, she talked about new information, new research, and concomitantly, new conspiracy. 19 community coordinators are there, embedded in the community on the front line to do two things: address new concerns as they rise, and provide new information as they also arise. That must be very essential. How do you think, Aru, that being able to do that is helping to improve the response to the pandemic?
Uh, hey, you were breaking out a little over there. I'm assuming you would just want
Yeah,
me to continue on that comment.
yeah. So what I meant is
Okay.
that Sohini said, uh, I was asking about the essence, the significance of having COVID-19 community coordinators out there embedded within their respective communities. In this case, in Minnesota, where ACER works, and she said it's important that they're out there because they're able to address, to share new information about new research, about new drugs that are coming out, and all that kind of stuff. And at the same time, conspiracy theories or anti COVID-19 campaigns or misinformation out there. So I'm saying, how do you think this is effective in terms of the entire response effort? How does this contribute significantly to the response to the entire COVID-19 response effort, the work that these community coordinators do?
Right. Um, I feel, and it's also to answer that question, I feel it's also important to understand the context in which such an opportunity came about for community organizations. So usually there is always a disconnect between like the mass media, the way decisions are made by authorities, and the way communities and the realities of that community. A lot of the solutions out there or the decisions might not actually reflect the real needs of the community. So having that opportunity, such as the Triple C project, it was significant because one of the first times money was channeled to the community, but this time having that empowerment to understand what's wrong with the community and take that, take that first-hand approach by the community itself. And that was huge, be it in education or were it through all the other requirements that came about the pandemic. So as Sohini was mentioning, all that, the kind of myths and misinformation that we heard in the community firsthand, I still find a lot of them, quite intriguing actually, how the concerns that we heard in the community regarding, what could vaccines do to me, or what could, or why do I feel my rationals for not getting vaccines is right? Like we have heard so many things in the community, and having that first-hand approach or first-hand hearing from the community really helped us frame the right strategies that worked for them. Similarly, be it when it came to vaccination clinics, like early on when the clinics were run in our community, even though the mass number of or the population of a certain area was predominantly BIPOC, earlier when the vaccines clinics came out, we observed that not a lot of our communities were out there getting vaccinated. It was predominantly the Caucasian population. And that was a concern our staff observed. Like, if the clinics are run in these areas where we are high in number, why are we not represented at these clinics? So clearly there was something wrong in the way these clinics are run. So that was it became another objective of our team, and we went about creating these outreach strategies that would help bring our communities to these clinics. Sometimes passing out flyers and letting them know that these clinics exist here is not enough. We realize there's a much extra step needed there. So we started resorting to our churches, our faith-based leaders to start spreading the message, help their congregation understand why vaccines are important. And then we took a step forward and we went to these churches. We went to their services, be it Sundays or in the working days. We went to them and asked what is stopping them from getting their vaccines. What do they fear in these clinics or coming outside and getting vaccinated? And once we started hearing these, we started taking the necessary steps to, help them out. We made sure these clinics were run in community spaces. We bought vaccines to churches, made sure the timing matches to that of a Sunday service, which definitely removed that access barrier that a lot of folks felt. When we used to go to apartment complexes to do, door to door, we have actually seen like the janitors or the staff working at these apartments say, I won't get my vaccine, but I don't have a car to drive to those clinics. So we clearly saw there was a disparity there. Like people, not everyone owned cars. Transportation is a huge barrier. So that was around the same time. ACER partnered with a local transportation service, Lyft, which is very similar to Uber. Lyft started helping us with free transportation rides to folks from home to the clinic, and again from clinic back to home. We started making sure when families were getting vaccinated, when kids were allowed to get vaccinated, we made sure these clinic spaces are more family friendly. So we had like a child specialist on site, providing coloring activities to kids so that they stay occupied and not feel.
What if parents are getting vaccinated?
Yeah. And family clinics take a lot more time to get vaccinated.
Wow.
So we actually had staff in person on these sites, making sure, folks understand that kids are getting vaccinated. It might mean a longer wait period. So just communicating, like really connecting with that community, communicating what the problem is. Another barrier we saw was also the registration processes. The county-run clinics had like all these intense registration process, like scan the code. There was also always a link to register. And as we all know, especially for communities of color, all that high technology can be a huge access barriers. So when ACER started hosting our own clinics, we brought like simple Excel sheets, like paper pen registration processes, and providing language and cultural support at these clinics, just essentially making it much easier for our communities. And we played a huge role in bringing more of our communities to our clinics. Yeah, I hope that answered.
Wow. That's a lot. Now I'm gonna go to Posa. I will just explain a lot. So if I'm thinking this is kind of facilitating access to vaccine and getting them, if if necessary in some cases, getting them transported, driven to a clinic to get vaccinated. Numbers are changing. People of color at the onset, people of color, it was disproportionately lower. The people of color who were getting vaccinated. Well, now I can fully appreciate what you're talking about. This must be a lot of work that went into this. So it's not just telling people the vaccines are available. Engaged in his COVID-19 community coordinating work was actually physically, tangibly assisting people to access vaccines. That's really hectic. Very good. Do you have anything you want to chime in on that before we move forward, Portia?
Oh, I'm just reiterating the point they said. The CCCs were meeting the people where they were, and MDH did a beautiful job collaborating with organizations that the people trusted, because ACER has been on the ground for, is it 14 years? So if people know ACER, people know POSA, people know ARU, people know Sohini. Aru, Sohini, and POSA got their vaccines at these same clinics, and it attracted more people, and we met them at where they were. And on top of that, these clinics also provided food on top of the incentives. We met them where they were, and it doesn't take a lot. And it's a very different structure from what we see on the clinical side, where they're timed visits, like 30 minutes, you're out of the door. I feel like it was more personable, and I hope we can do this for other immunizable diseases, because we know we have a problem with the MMR and all those other vaccine hesitancy. It could just be this triple C and the VIP direction is what we need to do, and just attain the vaccination levels we need. And also for other chronic diseases, this could be just be the model. Your grandma in the house who has diabetic foot just needs someone to come and pick them up from the from their home and take them to to the clinic, or someone to come and talk to them and actually tell them, go and get your colonoscopy done and all that stuff. It's a model that needs to be emulated by the whole of healthcare. I'm speaking from my previous act as a health professor. Yeah,
Across the
it should cross.
public health sphere. Yeah.
Yes, yeah, it should.
Wow.
Yeah.
Wow. That's fantastic. Hopefully, other other pandemics, if they ever erupt, I think we've learned a lot. We've built a beautiful model that works, and that is why we are here, because things could have been really, really worse than this, but they are not. Now, I'm going to sectionalize or throw these questions out to each of you. What challenges did the team, the coordinators, observe in the community during that have been witnessed or that were witnessed? We're going to start with Sohini. Sohini, let's talk about vaccine hesitancy. That phrase comes up quite a lot, quite often. And how they know we don't trust the vaccine, we don't want to take the vaccine. How do you deal with such people when you come across them?
Yeah. So vaccine hesitancy has been one of the biggest barriers through this process. And the important thing to remember about people who are saying that, oh, we don't want to take it, or they're hesitant, it's not that they don't care about their health, or they don't want to get it just on principle of it, but something's motivating them, the information that they know, or the reality of their life at that moment is what's informing their decision. So how we identify is that you can put vaccine hesitancy into a couple of buckets of how they're looking at it. The first being like complacency, where they don't think that this is that big a deal, or the information that they have about this virus, or what the media that they are consuming about this virus is telling them that this is not that big of a deal, people are just making a big deal out of it, you don't have to worry about it. Or they have other more important health issues that they consider is a more important, pressing and needed, that they are worried about, that their attention is focused on that aspect of their life. With them, you just need to sit down and like talk about the reality of it, show them they want to know, it's just the information that they have is not accurate. Second group of people can fall under the lack of trust, that they do not trust how the system is, or how the process has been. And you can't, the important thing is you can't discount them, you can't be like, oh, I think you're wrong, because everyone, it's based on something, right? Like the mistrust in the medical system, especially amongst our BIPOC community, especially amongst the Black community, is very rooted in historical um, issues that they have faced by the medical community. So it is important to acknowledge that, and then still walk them through with how it is with this specific thing on this specific ground. We cannot just tell them that you are wrong, because it is informed by history. And the last thing that we've spoken about that creates hesitancy, that we have spoken about earlier as well, is convenience of getting the vaccine, which is lack of access. It's if clinics are only open during hours where the adults are working, and it's difficult to take time off from work, or it's far away from work or home, they can't get to it. We need to get this to them instead of expecting them to come to us. Additional language barriers, technological barriers. There are just so many other systemic barriers that reduces the access people have, which adds to this vaccine hesitancy. And when you can address these different things in the right way, have those conversations, see what the community actually needs, only then can we address this hesitancy at large. It's very important as organizations, governments, this healthcare professionals at large, to recognize that people do want to stay healthy and they care about their family, and nothing that's coming out of them is malicious. It's just from misinformation and disinformation and the wrong news that they've been hearing.
Thank you very much there, Sohini. I agree with you. People should not be dismissed. Their fears, however unfounded, sometimes are not necessarily unfounded. However unfounded, it may see that person who bears that fear, and so they must be engaged, they must be encouraged, persuaded, provided with the facts, and just let them know that you care. Thank you very much. So on the issue of the disparities, the factors that contributed to the disparities that we've witnessed, especially in the community of people of color, and let's talk about the systemic ones, the systemic challenges, and that were noticed or were identified. What are these systemic challenges, Aru?
Your voice is not heard anymore.
Um, no, I don't know what happened, but we could
I
hear
think.
you
Oops,
first.
how about now?
Yeah.
Okay, yeah,
Now
sorry.
you're good.
My Bluetooth earphones do get like a little weird with my MacBook. So yeah, I guess I'm still in the learning process of understanding those systemic challenges. I definitely cannot say that I understand it to its full extent. But from most of the community partners that we work with, especially in the greater Minnesota area, so that would be like Duluth, Crookston, the Polk County areas. What we understand is that the disconnect that is commonly observed between, the decision makers, the authorities, and the community is a lot more massive in the greater Minnesota areas. Communities often feel that their voices are not, especially the community organizations who have on-ground experience of what is happening in the community. They understand what are the more immediate needs, that are necessary. Sometimes, especially during the pandemic, getting vaccinated was like the 13th or the 14th priority in their life. It was not the most immediate because there were other immediate needs that needed, consideration. That is food, like Posa mentioned, food and other healthcare needs that should not have been forgotten. So having that community perspective and making sure that the systems or the solutions you bring to the community are done after understanding that perspective is important. But unfortunately, what we see, especially once we get further away from the metro areas, is that authorities are not taking that step forward, building that relationship with community leaders who understands the community better. They're not taking that step forward to understand the true community needs before framing that work, that systemic work for them. And I'm still trying to figure out, what role can an organization like ACER play in bridging that gap? How can we advocate for authorities to, take a more culturally tailored programming towards public health initiatives? How can, programs be made more holistically for communities, not rather than having a monotonous approach of like, right now COVID is our agenda, let's just go and immunize everyone, but rather than taking a step back and realizing, how do we holistically reduce the disparities in these communities? What makes it even harder is that these disparities are often found, among people of color, especially the Latino and the larger Black communities that are living in the poor county areas. So yeah, that's my 2 bit on understanding the systemic challenges in Minnesota.
Okay. Thank you very much. Thank you very, very much. We're going to go to Posa to talk to us about that lead to or contribute to these disparities that were noticed or identified, misinformation, and of course the politics that's infused in the messaging, and it depends on who you how has that resulted or contributed to the disparities that we see? Uh, Deliberate misinformation, oftentimes by people who are influential. How has that, in your experience, been a problem? Posa.
Okay, I think we need to define or just expound on the two terms because we throw them around a lot. There's misinformation and disinformation. So misinformation is when it's an intentional spreading of false information. I can give an example of flu vaccine. In the 90s and the 80s, the flu vaccine was only supposed to be given to the people who are immunocompromised and the elderly. But with science and all that stuff, the current knowledge is flu vaccine should be given to everyone every year, right? But the information that's still going out is the information that we had in the 80s and the 90s. So that bit would be characterized as misinformation. Then disinformation is the deliberate spreading of false information. And we've seen both misinformation and disinformation during this whole pandemic. And it's been a huge challenge in the BIPOC community, especially through social media, Facebook and WhatsApp, because by a click of a button, something goes. And so my grandmother in the village has the same information I have, but no one is there to teach her better. So she will grasp that and stay with it. The other source of misinformation and disinformation has been church pulpits, and of course, in this country, the left wing and the right wing of politics. People take a stand. So long as my favorite politician has said no, I'm gonna stay with that person. If my favorite politician has said yes, I will stay with that person. And we can see the breakdown of vaccination rates amongst everyone, all races, all creeds, all colors, has been informed by our political choices, and it's been a huge barrier to get over. Even people who've been admitted and stayed in the ICU for days and days, and have stuck to what their favorite politician has said. So if their favorite politician told them to get vaccinated, they will get vaccinated. If they not, they will stay unvaccinated. And we've lost so many lives. Very many lives have been cut short because of this problem. But as ACER, we've tried to educate our people and all the material we put out is in the languages I mentioned: Hispanic, Pidgin English, and some are in Swahili. And at least when people see people who look like them talking about these things, the impact is very huge.
Makes a lot of sense. Makes a lot of sense. Let the messenger look more like the person for whom the message is being put out there to encourage them. Folks, if you're just tuning in, this is a panel discussion that you're watching with the Health Equity Team at ACER, based in Minnesota, and it is sponsored by ACER. And we're discussing with three professionals, healthcare professionals. We're discussing the general pandemic response and the work that ACER has been doing. We're talking about the impact that they've been making, the contributions. We're talking about the general difficulties and challenges that have been faced or have been experienced, and how these COVID-19 community coordinators have been able to navigate them. And they've been very largely successful in getting people out to vaccinate, sometimes even facilitating getting these people to places where they need to go to get a vaccine. We're going to now move on to, we've heard a lot about so-called trusted messenger programs. What does it mean, and how is ACER involved in such an initiative? What is a trusted messenger program? I'm going to throw this to Sohini.
Yeah, so one of the things that at the start of the pandemic, a lot of people realized is that to get the message to the community, it needs to come from the community. And that basically gave rise to the Trusted Messenger program. The focus of a Trusted Messenger program is to basically address that misinformation, disinformation, false news, and narrative, utilizing trusted elders, leaders in the community who are already known by the community and who are from the community. And uh, so, one of the programs that ACER is involved in is a Trusted Messenger program that ties in with some from MDH, but also with a community organization called MICA. It uses a collaboration of multiple organizations across the state of Minnesota, and the goal of this is to partner with organizations and shelters to inform those experiencing homelessness and increase their access. So the community organizations that we're working with, they are all working with or a part of that community that is providing support to the those experiencing homelessness in Minnesota. They see themselves out and about, they are familiar. So when these organizations are talking to them that this is the issue and there is an already inbuilt trust that helps these people accept what is being said and actually get vaccinated. That's the general goal of a Trusted Messenger program, that the messaging comes from those who are trusted and the community feels comfortable listening to.
It increases the chances of one believing the message because of the messenger that exists between them. That's good. Thank you so much, Sohini. We will go to now. ACER has been involved with a number of other coalitions, working with them in partnership, all these different organizations to address health equity. First of all, the phrase health equity, for someone who doesn't understand that, what does it mean by health equity? And share a little light on this for us. And how is ACER involved with these other organizations or coalitions that are working in this field? Let's go to Aru.
Yeah, sure. I guess defining health equity is quite challenging. But I would say ensuring that every single individual having opportunities to ensure on a population level they all achieve the same health outcome. And I guess a big piece of health equity would be to understand what the challenges this individual is facing before achieving the said health outcome. And I guess that's how it differentiates from the term health, like, or the term equality, because I feel people believe if we make all the vaccines free, everyone should be vaccinated, and there wouldn't be a health outcome or a disparity. But that's not how the society functions. Even if the vaccine is free, two individuals could face two separate issues due to which they cannot have that vaccine. It could be misinformation, it could be religious reasons. So I guess that's where equity comes into playing, like understanding that individualized challenge and then ensuring that we create a program or an initiative where those challenges are addressed so that everyone could achieve the same health outcome. Um, and I guess ACER have had some really valuable connections and coalitions that are still ongoing that has helped us, take that step forward towards health equity. Health on the Go is one similar coalition that is underway right now. So Health on the Go, or HOTG as we call it, is a collaboration between Brooklyn Park City and the Brooklyn Center City in Minnesota. And we often talk about these systemic challenges just in this single call. So I guess HOTG, what they did was trying to reduce those systemic challenges a little bit by enhancing the communication and the coordination between the cities and the community organizations. So when the HOTG project came about, Brooklyn Park City, Brooklyn Center City, ACER, like community organizations, and the Hennepin County all came together to essentially how well can we use the COVID funds that they have received from the federal government, and how can they ensure there's a community-centered approach in, providing those COVID services to the community. So one of the first things that the coalition did was ensuring a mobile clinic. So essentially, they turned a mobile vehicle into a moving clinic that can be transported to any area within your city and provide the most necessary services. So in the year of 2020, when this came about, pandemic was the biggest necessity. So we started providing COVID-19 vaccines and testing resources. And like we mentioned, sometimes vaccines are not the priority in our community for very valid reasons. So we also ensured this care is, provided in a more holistic way. So we started providing other resources that are necessary to our community. So including food, testing kits, once at-home test kits were available, even then, masks, PPE. We also started collaborating with like COVID-19 vaccines and dental care clinics and other basic preventive care services that are necessary. So it could be like BMI checks, blood pressure checks, etc. And the
Just to
goal of this
incentivize
coalition
them.
is to think beyond. Yeah, yes, essentially. Yeah. Essentially, like making sure that, we do not think one dimensional when it comes to health equity. There are multiple services and care that our community needs. So providing all of them together. And hopefully, once the pandemic is slowed down a lot more than it is right now, we can actually provide more preventive care services that are vital for our communities. So, Winnie, do you want to share a little more about other coalitions?
Yeah, sure. Another coalition that ACER has been sitting on, and we're slowly building it. It's relatively new. Is this coalition that was formed by an organization called Voices of Racial Justice, and we've gotten funding from organization like Blue Cross Blue Shield to help this work. And the idea was coming out and first proclaiming the statement that racism is a public health crisis, and based off that, working on policies across the state of Minnesota that basically address this issue. So the coalition convenes different organizations from across the state of Minnesota representing the diverse groups. So it's not just about the Black community, it's not just about the Hispanic community, it's about having someone at the table from every diverse community in the state and being able to bring up issues that they are facing. The ideal in the upcoming years, what we do really want to work with is find those policies that already exist maybe and see how it implementation of it can help benefit our community, or someone one of our representatives wants to introduce a new policy, study it and see if it's actually useful for the community or is it very biased in how it's going to help. So that's the general goal of this coalition. We're just building it, everyone's just getting to like know each other and see how things work out, but I have high hopes for it.
That's very, very good. That's good, very, very good. So, the final question I have for you, ladies, and I want to say thank you very, very much. Quite educative. I've learned a lot. I've come to fully, well, I wouldn't say fully, to and appreciably understand the magnitude and the significance of the work that ACER does at all levels. You know, in some cases, you have to incentivize these people to get them to take the vaccines. You got to help provide other what they consider healthcare priorities, like she said, screenings and even dental and all that kind of stuff. That is really sweetening this thing up just to get them protected. It's beautiful. So one last question, and which each of you can take a stab at, and in your conclusion, your closing remarks. I want to thank you very much. We've been here for almost an hour now, very educative. And what plans does ACER have? The ACER Health Equity Team. What plans do you have for the future? What are your priorities going forward? And what informs those priorities? And how has COVID-19 and the work that you've done on the response front, how has it inspired your plans for the future? So we're going to begin with Posa, and then we'll work our way around to Aru, and then we're going to close with Suhini. Posa,
I think we need
what
to go back
plans?
to the we need to go back to the beginning of the starting of ACER. When ACER was started, it was just like a job site, almost like linking African immigrants to jobs. But when the founders thought about the underlying issues that were making these African immigrants look for jobs, they sought for a way to address them, and that has been the push that pushes that's English, yeah. That pushes ACER, trying to address the systemic issues that affect our people. So addressing systemic um, systemic issues like racism, social determinants of health, and so with and as we've seen through the CCC and the VIP project, these models can be used in the future for other issues, chronic and acute illnesses. We don't have to wait for a pandemic to do well. So ACER is gonna go on to address these issues, and that's just not for the health equity side, for the economic development side, for the housing side, and the organizing side. We need to address every issue holistically, and I think I'm just saying as an intern, but I think that's where the direction we are going towards. I can be corrected by my colleagues Aru and Sohi.
Yeah, thank you
I
very
think
much. So we're going to go to Aru, who's in charge of you know health, the health program. Aru, what's the future? What's the plan? What do we expect from ACER, from the health equity team in the next 5 years?
Oh, yeah, sure. And I'm not in charge of the health equity team. That would be my manager. But I think Posa was on the right track. Essentially, I can see ACER going in that direction, like addressing systemic challenges, like just figuring out where does ACER stand. Like we see all these disparities, especially our community partners in Greater Minnesota. They see that disconnect between authorities and the community voices. Like, so I guess our work would be mostly about figuring out what role does ACER play. Like, what kind of advocacy would we be doing in order to make sure that that gap is bridged. How are we making sure that community voices are really raised with authorities? Next time when a pandemic is around, how do we make sure the challenges that we observe this time does not recur? And then while the pandemic has been the focus for ACER for over 2 years now, I feel we would be essentially taking a step back to look into the other, equally important challenges that we face in health equity. So the biggest one would be social determinants of health, like Pusa mentioned. Right now, ACER is looking at physical activities and nutrition. That is something that we dabbled in, even before the pandemic came, but the pandemic just stole the highlight from it. So essentially, we want to go back to that, building that infrastructure within our cities to make sure our communities have equal access to good nutrition, having that pattern of physical activities in life, staying healthy, and ensure that disease burden doesn't fall on our communities of color. So yeah, I guess those are two big things that stand out for me.
Harold, thank you very much for your contributions on this panel, and very educative. Thanks to you, Pausa. And we'll go to Sohini for her closing remarks. Sohini?
Yeah. I think one of the big learnings across the board for during this pandemic has been partnerships and listening to the community. ACER has always been ACER's work has been informed by what the community wants. And going forward, I think that is what we're going to be focus on and stick to. Just, keep doing the work that basically brings our community to just improving access and just brings them up to par with and heading towards equity. Yeah, and like I said, partnerships has been a big thing for ACES since I've started working on. We've always had community partners supporting our work, and I hope and I believe that we intend to keep working together.
Well, ladies, thank you very much. I want to say good evening, and it has been a very good and educative discussion on the response work, the role ACER has been playing since the outbreak of this pandemic, and what it continues to play. I want to commend all three of you. It's been my pleasure to host you and to learn and create the opportunity for others to learn. We've come to you, our audience. We thank you for watching, and many of you, thousands of you who will watch later on around the world and in Minnesota in particular. And we thank ACER for sponsoring this, making it possible for people to learn, and not just in Minnesota, which is the target audience, but people right across. We're watching on YouTube as well as Facebook. Thank you so much. I look forward to having uh, the three of you next time. Have yourselves a wonderful evening. Thank you.
You as well. Thank you for
Thank
having
you.
us.
Bye.
Yeah, thank you for sharing our voices across the board. Yeah, we really appreciate that.
Yeah. Thank you. Bye bye.